agenda. Did you want me to pull that up, Monica?
Sure.
To look at, other than our face.
And Sarah and I are going to kind of go back and forth in this. It is not highly scripted, so feel free to ask questions as we go. We don't guarantee being able to answer all your questions at this point, but today, since we only have an hour, we are going to try and keep it somewhat focused on the work plans. So this first part of the agenda is going to be brief updates, even though it might be some of the things that you're most curious about. So we have, oh, Sarah, I was just starting and you said we were going to give a couple more minutes. Should we start? Okay. Yes, as people have started to do, please put your name and agency in the chat. Perfect. We are recording this for those who weren't able to participate today, since it is a Friday afternoon and a few people just got the invitation yesterday because of a glitch in the email list. And so we are going to just give you some updates about SOR2 prevention and how it's the same and how it's different and how we're going to try and manage that distance between like prevention.
Can anyone hear Monica? No. Oh.
I cannot.
Okay, well, we're waiting for her. I just want to make another note about the context list. If you know of anyone who's supposed to be, who was supposed to have received an invite to this presentation and wasn't able to, please have them fill out the Google form. I can resend it out if people need. I also sent out the Excel sheet. We're trying, there's been so much turnover and we were operating from 4 different lists. So we're really trying to get that all caught up and tidied. So if you could please help us out and send us anyone you know who's supposed to be on here but wasn't. Even if you're not sure, please let us know so that way I can check the list and confirm.
I sent them the Gambling radio ad too. So that
Okay. Did we lose Monica? My grid view doesn't let me see everyone. She might pop back on. She might be popping back on in just a second. So,
Sarah, can I ask a quick question while we're waiting?
sure. Mm-hmm.
Where are all the recordings being saved or sent out? So like the trainings that were in January and early February, have those recordings been posted or sent out anywhere yet?
Those were the ones with Leslie?
Yes.
Yeah, okay. I'm not sure, honestly. I would need to check in with Leslie. Monica might know when she gets back. I can double check with her.
Okay, thank you.
I'm sorry. Back on. I'm so sorry. Of course, that's the one time today that my internet just drops.
That's the way it works.
Barry
had just asked a quick question about, do you know if the recordings of the trainings that Leslie provided, are those on a website or is she sending those out? Do you know?
I have not checked on Rallyhood. Have you checked on there? I know there's a lot on there, but I haven't checked on there yet. I know that that's where she puts a lot of the materials. And so I saw that there were like checklists for fidelity to the materials and presentations and whatnot. But I didn't see, so I don't know. So I'm sorry that happened right in the middle of talking. Sarah, I assume you just kind of picked up where I left off, ish. Basically, you know, we're trying to keep as consistent as we can with what direction and guidance our IDPH prevention staff are giving to the IPN prevention staff, which I know for most of you, you're not the same people, but for some of you, you are either supervising both or perhaps are working on both. And so it'll be important that within your agency and or within your area that you're serving, that you're in very close contact with the IPN prevention staff, so that there isn't a lot of duplication and or confusion and overlap in the services you provide. That should be pretty easy, hopefully, through a lot of the guidance that we're trying to provide. But, you know, at the local level, it works out differently at different places. So for sure, take that initiative, even if you're a new staff person, and try and reach out to your local IPN folks, find out what their work plans look like, how they're doing things, what they're planning to do around opioids and or stimulants, if anything. I think that I was told that only 1 or 2 agencies have a stimulant related goal in their IPN work plans. So hopefully there won't be very much overlap. But some of you have other grants as well, like SIPTO and mentoring and all the other prevention grants. And so I know that it can get a little bit complicated. So what we're trying to do is be as consistent as possible. If you have questions, feel free to email them to the SOR email, which is sor@idph.iowa.gov. That's the quickest way. If you send an email to me and or Sarah, we will eventually get to it, but I, depending on the week, am sometimes pretty slow at getting through my emails. So you will probably get a quicker response through the SOR email. Now that said, sometimes we have to go and search things out. And so you won't necessarily get a quick response if you had hard questions. So just keep that in mind.
And Monica, this is Lisa, and that's something really to be aware of because my agency has 4 SIPTO grants and they are now working on their strategic plan and then their action plan and logic models. And they are also implementing the media campaign. So we're trying to be very careful to make sure that there is no duplication with that. So Cassidy and I met this morning. So we're really working hard to make sure that that is done correctly.
Great. Yeah, thank you. And I think, you know, what you'll see here is that we're trying to provide as much flexibility and options as possible, but what we're providing may not work. It may not work for all of you to do all the things, right? Because of some of those grants and other limitations in your particular area. You may or may not have the opportunity to use all of the options that we give you. So let me, we're gonna do the work plan first before we do the guidance. Good call. So we have another guidance document. We gave you just a super basic prevention guidance document. I don't know, like a month probably ago now, maybe more than that. And that I think has been posted on the SOR website. That website I could grab while Sarah gets the sample work plan out. But there's a website for SOR that has like all the provider information on it. And that is where we're going to be posting a lot of the prevention documents. I will try to get like a Rally Hood thing. I'm not a Rally Hood person, so I'm really trying to learn it. New platforms and all that joy. So I have a membership or whatever now account, and I could see things, but I don't yet have a page where I can post all the things for you. So I don't know if you all have that or if you, no, I see some heads shaking now. Okay, well, it's, they're using it, the other prevention staff are using it for IPN prevention and, or maybe just SIPTO. Lisa, do you know?
Yeah, just SIPTO right now.
Oh, that's
Yeah, we don't use it for IPN. I mean, I like the SOR2 website, being able to go there to find stuff.
We're going to stick with that. Leslie uses it for SIPTO. And so because Leslie is going to be our point person on training for prevention, she might have you log into it and or use that to access some of the training materials. So I will see if it's possible to put those on our IDPH website, but I kind of doubt it, so we'll see. So yeah, we'll find that SOR website and put that in the chat here in a minute. Sarah's going to start with the work plan, and basically we're using Zion's work plan just because then we didn't have to, we figured like a work plan is not a privacy document, and it doesn't have any client information in it, and so it's fair to just use one that was submitted very well in good level of detail to be able to point out the things that we're really looking for, because pretty much everybody is going to have to resubmit their work plan and just add in a few levels of detail. So you'll see as she's talking through some of the dosage specifically and frequency of services and how many people are going to be reached, especially with media, will need to be edited and given a little bit more detail. And hopefully now, either if you're a new staff just brought on, or if you have had a hand in writing the work plan, you will have a little more time to be able to pull that detail out. And also for those of you who are trying to see the PowerPoint and maybe on a small screen, if you go up to the top under view options, the little caret pointing down next to it, you can do the zoom ratio differently. So you can also scooch the bar if you have people showing up on yours and you want to just see the Word document, you can scooch the sidebar in between those to make one or the other bigger. So that, at least for people who have old eyes like me, is helpful for viewing so that you can see what Sarah's talking about here. All right, so Sarah, I'm going to hand it over to you for the work plan a little bit, and feel free to ask me to say stuff if I missed things.
Perfect. That's what I was just going to ask you if I missed anything. Okay, so I just wanted to do, again, because a lot of people are new and we had zero guidance. We understand that we had very little guidance on the first work plan because we were still hashing out all the prevention pieces. So now we have a little bit more idea and we've had time to sit with them a little bit. So we just wanted to show you, first off, I'll start with like the parameters of a work plan. So there's the action steps, the timeline. We understand that the timelines, you know, there's no crystal ball. You can't get it exact. So, you know, day, you know, month and year is pretty important just to get an idea. Are you going to do it at the end of the month or begin, you know, like just, this is kind of your Gantt chart for those that are like me and love Gantt charts. And then location as much as possible, county level specifics are fine. Activities and outputs and short-term outcomes. So I think this was the piece that we saw a little bit that some people struggled with kind of teasing those two out. And we know it's not always super apparent the difference between activity output, short-term outcome, and action step. That all sounds pretty similar. We understand. So action steps, that's why we wanted to show this one. So this action step is pretty well done, and that's, I would say, try to think of SMART objectives in general. Conduct 12 MAP presentations, so that's a clear dosage on the type of presentation that you're planning to do and to whom is going to, which is great, and how many participants you expect. I think there's a little bit of, could everyone make sure that they're muted? Take a quick, just real quick. Okay, so 70 participants on MAT, either in person or through a live virtual platform. So in terms of participants, we would actually encourage you to go as high as you can. We would rather you, it's a work plan, so I don't think that there's any, right, Monica? I don't think there's any negatives if you don't exactly hit the goal of the work plan, like the number of people in the room. We would prefer though that it be more than 70, right? Like,
yeah, so it depends on the venue, right? So yeah, if, thank you, you know, if you're in a big county that has, you know, 500,000 people in it, well, I don't know that any county has quite that much, but you know what I mean? If you have a county that has 5,000 people in it, you're definitely going to be closer to 70 than you are if you live in are serving a county with, 50,000 people. So
Mm.
we want to be cognizant of the service area and also the target audience.
Mhm. Yeah. And then,
Could you,
Oh.
could you just scroll up so we can see kind of what they
Sure.
used as the long-term outcome? Because what I used was kind of what Monica put in the
mhm.
way back in October, November. I just want to see
Yeah.
kind of how that was worded, please.
Oh, sure. Up here, the priority. Okay. So yeah, they said priority prevention and Medicaid assisted treatment. So this is for their MAP priorities. And that's another thing. We noticed that some people had like 1 or 2 priorities. Again, we would encourage you to go as far as you can. We have resources and you have time. Hopefully you should. So we'd really like to saturate as much as possible. So
And
Hi,
I
Sarah.
think
Sarah, this is Vicky. I just had
Yeah.
a quick question about, will you be sending out like a guidance document or a document out? I mean, going over it, it's fine right now, but
Yeah.
just a document that says specifically what
Definitely,
you're
yeah.
expecting. All right.
Yeah, because everybody's work plans, some people had great detail in their action steps, but then didn't have, much as far as location or outputs or, vice versa. And so I think when you get the specific feedback for yours, those will be the items that we expect to have seen changed. But we wanted to go over the basics too, just to make sure that everybody was on the same page, because some
When
of you
will
have.
those be due? Do you know? Have
What's
we
that?
mentioned? What's that?
What did you ask?
When will they be due?
We're going to give you some time because, we told you that you could go ahead and start with what you had submitted. And so I assume that everyone is able to be working on, what they've submitted. And we're going to ask you to, did we decide, Sarah? I feel like it was either mid or late March.
Yeah, it's like a month from now, I think is what we were kind of thinking.
So, and if that's problematic, you can, request, but that the changes that we're going to ask for are not huge for the vast majority of
Yeah.
the agencies. So it shouldn't take too long. It'll be a matter of, getting a sense of what the population is, which hopefully you already have in a document somewhere, an assessment workbook or whatnot. And then getting, some percentages and things like that. So.
Yeah. I think just building on what Monica said, it's not the, none of the actions are really the issue. Like she said, when we said, go ahead and do what you're doing is still good. We just needed a bounded a little bit more, fleshed out a little bit more so that we can follow up in a more informed way and have a better idea, like we were talking about with the alignment and things. So that just helps everyone it helps you think through what you really want to do and accomplish for your year or 2 years, so that you can build and grow your objectives over time. So it's really more about that than us coming in and saying like, oh no, stop what you're doing. No one's going to be, I don't think anyone's, as far as I know, no one's going to be told that. So yeah, no worries in that respect. So
Will you,
yeah.
return the work plans we submitted with your comments on it? Okay.
I think, yeah, we could do, we have it in an Excel sheet, I think currently, but we could.
Yeah, I don't know if they'll be like specifically on your document, but we do have like a little report that'll say like, make action steps smart or objectives smart or, things like that, should make sense after we get through this.
Yeah.
And when are those coming? Are those corrections coming out soon?
Yeah, hopefully next week.
Next week, okay.
Yeah.
And maybe we could make it a month from when we give you those corrections for redoing. Like yeah,
Good.
good. Okay, that works. Good.
If,
Um,
I'm sorry, I have a question.
Yeah.
If we need specific guidance, we actually have some staff turnover occurring. And if we need specific, can we get technical assistance from either you or Monica?
Yeah, although it might end up being better if we loop in either Julie or Katie on that as well, because they were teaching us how to do it.
Thank you.
Perfect. Okay. So, where was it? Okay, so we talked about the action steps. Yeah, this would just be like, what are your plans for each priority? So what are the actions you're going to do? So obtain materials from IDP for map presentations. Perfect. Reach out via email, phone, or face-to-face to 12 first responder agencies or healthcare. I would just maybe just explain why 12 in some way, a tiny, just a brief explanation, 12 out of X number of providers in your community or whatever it is, because sometimes it feels a bit like we don't know how to follow up with that, I guess. Like I said, like it just, to check in that the objectives are meeting your needs, or, just for us to provide a little bit more TA. It's hard when we don't know what these numbers mean or where they're coming from. So I would say, does that make sense?
And that's a good, yeah, that's a good point, is that, in this case, for example, 12 agencies might be all there is in those particular counties. And so if it says like all 12 of the, first responder agencies available in these counties, then we know that that's, the top number that it could be. Or if you have a county that has 25 in it, and you know that that's maybe not realistic for a particular goal, then you could say like, we're going to try for 20 of the 25 or whatever. So, so keep that, give as much context as possible so that when we're looking at it, because we don't have every service area, cities and populations memorized, then that'll help us have a better sense of the dosage that's being provided.
Yeah, and with the action steps, if you're saying, okay, this is what we're going to do, activities and outputs would really be, how are you going to go about it? What are you, how is that going to work? So if you say, conduct 12 presentations, you're going to document an iSmart entry, complete post surveys. So you're going to have the post surveys to assess how you these things, right? Because you got to figure out who's there and from where. So that's how you're doing it, and this is the outcome. Because so it'd be, we did that was why, and then this is what we got from it, or this is why we chose to do this. Does that make sense?
It does, but I have a question. There's iSmart entries for the SOR2 grant?
No, there's not.
Okay, thank you.
They were just basing it on IPN, which there is for IPN, but there's not for SR.
Right, I was gonna have a little bit of a meltdown. We're good.
Sorry. Yeah, sorry. Yeah, again, like the actual, and this is, we're just trying to use this as a way to conceptualize the work plan situation. So the details. And so again, here, there should be some more short-term outcomes. Like you could, for example, here, hand out brochures, fact sheets, and share information on dangers of STIMUD OUD in the community to X people, and 100 of them. So then I would actually like here, how are you going to find those people? You would probably need to create the brochure. Are you creating the brochure? Where are you getting the brochure? Just a little bit, just thinking back the steps. And then after that happens, what's going to be the net result of handing out the brochures to 100 participants? What is the output from that? Like what's something, and if you, as measurable as possible, we were talking about SMART objectives, something that you can look to see if it did accomplish what it was you were hoping to accomplish. Does that make sense? Okay.
I guess I have a question about that, like the brochure.
Sure.
Yesterday we were We got an email from Leslie saying that, you know, they want to keep the brochures and all that consistent. So we won't be creating our own brochures. Is that correct? And fact sheets and all of that, because they want us to all be consistent.
Okay, so one of the things I was going to say at the beginning about the difference between this grant and some of the others is that IPN has very specific guidance and therefore has to be a lot more strict with what they can have providers doing because SAMHSA is monitoring IPN through the block grant. And so they have very specific feedback that they've received from SAMHSA saying you need to do all these things and your providers need to do these things. SOR was created by SAMHSA to be a lot more flexible than a lot of their other SAMHSA grants. Now, of course, you know, the downfalls are that it's a shorter grant and very specific to opioids and stimulants right now. So while you can't go out and do everything with SOR, that's one of the things that, for example, if you see in your community a need for information specific to childcare providers or, you know, firefighters or volunteer firefighters rather than, you know, whatever, you can create that, but we would like you to send it to us for a quick approval before you use it. So if you use that SOR email, that would be great.
Monica, I think that's why it's been a little confusing because the emails that we've been getting, it doesn't, there's no who are they to? Like from Leslie, it says you need to use this and you need to use that. It doesn't say who it applies to. So
yeah, and that's a good piece of feedback for our team that we will try and keep in mind. I think one of the things that we're trying to do on the SOR side is send things out from the SOR email so that it's clear who it's for. If it comes from the SOR email, it's only for SOR funded folks, right? And it's only relevant necessarily to SOR funded services. So I will give that feedback to Leslie though, specifically about making sure she's clear on what the SIPTO, I think almost all of hers are right now are specific to SIPTO because that was what she was hired for. But not everybody has SIPTO. So if she has a larger email group, then I'll have her be more specific about what she's talking about. Good question or point.
And Monica, there are 9 counties that have been funded with SIPTO. So just
Correct.
to give you a little bit of background,
Yeah,
or for those who don't know
right
about that grant.
Yeah, and that's something that we're also trying to, well, we'll get to the media, I think, here pretty soon, but we'll talk a little bit more about options and flexibility with media too.
Perfect. I just have one more thing to say about the work plan, and then we can take questions on that. But I just wanted to draw your attention to the priorities and then long-term outcome, strategy, target population. So when we're talking about the action steps, I kind of went in on the action steps just to try to, like, you know, start there. But all the action steps and outcomes should inform your long-term outcome. So you know, I think most people did a great job of, you know, making it congruent, you know, like your target population made sense and it was the same one throughout your priority. But, you know, just that piece right there, or your action step, when I was talking about making sure your outcomes are something that you can look to later to determine if it's meeting your needs. You can check back with your long-term outcome. Is the short-term outcomes that we've written down here, these, you know, SMART objectives, how much are they meeting the long-term outcome? And then you can look at them over time to determine if you're hitting the goals that you want or revise. You know, Monica said we have a little bit more flexibility. So it can be in qualitative data, we love to say iterative or living document, or if you're going through things and you're like, this is not working out how we thought, like, you know, it's grants. So that's, I mean, I don't think that we have an issue with that, Monica. Am I speaking too much? But I think that we tend to be pretty understanding of that. And it's even easier to approve exception requests or whatever if everything's well documented. And if you're able to really clearly describe why you had to pivot, or, you know, it's a pandemic. Pivoting is what we're all doing right now. So just keep that in mind too. It helps us kind of follow you and kind of see where you're going and why you needed to go there. I guess that's the best way to put that. Anything else, Monica?
No, there was just a good question in the chat about documentation of prevention services.
Yeah.
And that'll be noted in, I think that's in the additional guidance, but it was also, I don't know, it's been mentioned somewhere, but we do have a monthly training tracking form that we want you to use. And then the larger outcome, there will be a few larger outcomes that you'll report in the quarterly reports that you'll submit. The quarterly reports for SOR are joint between prevention and treatment. So that will be something you'll need to partner with your agency SOR people. If it's not you, then you'll need to partner with them to make sure you have answers to all those questions that go into the quarterly report. That is a report specific to SOR that's submitted via Qualtrics, and that information is also on that SOR website. So, so yeah, the monthly training tracking forms, you don't actually have to turn into us, but when we come and do a site visit, we will want to take a look at them. So you still have to keep them, you know, updated and have them available.
Okay. Any other questions about work plans? Or like we said, we'll be sending the guidance document with a little bit more of the nitty gritty of what we were just talking about. But does anyone have questions between action steps and outputs or short-term outcomes? Because that was what we saw the most of, I think, like just some confusion with what the ask was there.
And there was a clarifying comment in the chat too about how IPN only requires one short-term outcome per per priority, is it? Or, but
Strategy.
it depends.
Should be strategy.
And so that's fine, and that's kind of the minimum requirement. But if, you know, for some of the action steps, if they have different target populations and you can have or feel like you're getting a slightly different short-term outcome, then you can add those in. But yeah, that's fine to just have one per strategy. All right, so we're going to be sending back your work plan guidance. Now, I suppose it would probably be easier if we sent back your actual work plan that we reviewed, but those are all in Iowa grants, right, Sarah? The work plans, that's where you submitted them. So that's where you can find your work plan between now and whenever. If you want to look at it, it is in Iowa grants. And if you don't have access to that, you can ask your management or leadership at your agency because they do. And I'm going to share now briefly the additional guidance. Let's see here. Document. Now this is a 9-page document right now, and it's not totally done yet. Can you see it? All right. So this is something that you'll learn or might not learn about me, is that I am not an overly detailed, I am detailed in many ways. However, I don't love this kind of detail. So it is a team effort to get to this level of detail and guidance. And I know that not everyone likes this level of detail and or guidance, and I appreciate that. But for clarity's sake and the fact that some people really thrive on it, we are providing it. So this will give you specific information just about the expectations that we have for prevention services under SOR. And it talks about, you know, partnering with and talking with the SIPTO and IPN funded providers in your area. It lists the SIPTO counties there if you don't know if they're in your area or not. And then it talks about the trainings that are available and the things that you should be able to learn about and train on. This topic list may change slightly, but what's there, it will stay there. So we might just add some more things. And if you have suggestions and or things that your community asks you for that you think fit best in SOR, please feel free to send those to us for inclusion here.
So we're not allowed to train on all the trainings that Leslie told my staff that they could train on, like the trauma-informed care trainings and all that, because that is what was in the training site.
For SOR or for SIPTO?
Well, I don't know, for whatever the mandatory training they had to go to for the psychostimulant or the stimulant training.
Yeah, so the stimulant training, we're going to try and be fine with all of that. But that's one of those, I don't know yet.
Okay, well, because yeah, there were other trainings listed in there besides the stimulant training, and we got an email that said we could train on like trauma-informed care and all that, but I don't feel comfortable with some of my staff members training on that there because they're not as knowledgeable on those things.
Right, and that's on this list. Actually, it's just not one of the ones with a link, which is part of my challenge with this list. But if it's one of those things that these are options, they're not, I don't think that they're all required all the time, right? So if you don't feel like your staff is yet prepared to train on a particular topic like trauma-informed care that is complicated and difficult, then don't have them do that.
Monica, now I've got 3 trainings next week that were from Leslie that I think I should go to as the SOR2 prevention. One is prevention skills part 2. Then one is primary prevention strategies to address opioid at the community level. And then the third one is stigma associated with substance use disorder.
Yeah.
So we need to go to those, right? I mean, yeah. Okay.
And that's why we want, Leslie is going to be the point person for training. So if you have questions, when you ask Leslie questions, please try and specify that it's for SOR so that she's able to either loop me in or, you know, copy me on her response so that she and I are giving the same answers. Because that's just something that we're, you know, trying to learn to do better.
Thank you.
So just for clarification, we won't just be limited to the trainings that she is providing to us, nor are we expected to use those specific trainings?
Okay, so if you're gonna go and do a training on stimulants, it is my understanding that you are supposed to use the training that she provided.
Yeah, that was my understanding too.
Now, if you have a need or a problem with what was provided and you feel like it doesn't meet your community's needs, then send me an email about it and we can take a look. Because like I said, SOR is a little bit more flexible than some of the other grants that the department has. So there's a possibility there, but I wouldn't say it's guaranteed yes or no at this point.
I know the biggest problem with the stimulant training was it was very academic. and it was more geared toward docs. And we're required to present to our clients and family members. And I think that it was just too much.
Mhm.
So that, I mean, that's a general thing that I've heard from quite a few people. So maybe take that in consideration, because I don't think it's appropriate for the client population.
Right. Well, and that's one of the things with SOR, as an example, that I am okay with, as far as changing the length of the trainings, because I know that they have a 90-minute minimum right now. And that is not necessarily in line with the expectations I understand from SAMHSA for SOR. So I'm trying to get a little more clarification on that, but at this point, I would say you do not have to do a minimum of a 90-minute training, and Julie might get mad about that, but for SOR, there will be times when it's more appropriate to have a shorter training. So please let me know if you're doing that, just so that I can defend it when people challenge me on it.
Is there, so is there a possibility? I've been kind of using this time to speak with key stakeholders to just kind of get an idea of, you know, how this will roll out. And so, like speaking with the drug task force sheriff, we have them on medicated assisted treatment. And I mean, his feeling was in the rural areas, because he's from a rural county that I have, they don't have hospitals there. So he said oftentimes, or most of the time, it's the law enforcement that is the first responder. And he said they aren't trained to do Narcan. They would like, you know, kits. So if
that would be perfect for you all to provide.
Okay,
that's exactly the kind of thing that prevention can and should do.
Okay, so we could kind of, and I've heard that, yeah, there's multiple needs. So even if I use one of the PowerPoint trainings as the basic one to the group I'm at, it is okay to, because probably not all of it would be appropriate, to pull that out. And could I add then some slides from a couple of the other PowerPoints that would also meet the needs that they're asking for, kind of put in, as long as we don't, I think Leslie was concerned about that we don't change the integrity of the message of the slide. So if I'm using those slides, but you know, if I'm going to be there, I guess as a social worker, my brain says, well, I should add a few of these from this one and a few of these from this one also. Is that making sense? Or
yeah, and I think I would say have two slide decks that you just, you know, kind of put together, or end one and then start the very next one, so that you can say, like, this is, I'm still, you know, same person from the same place, but this is a new topic, and you know, this is the information that is relevant to that topic.
Great, thank you. That yeah, that's very helpful. Thank you, Monica.
Yeah. So one of the challenges is that you know, there is a lot of information out there, and as you know, kind of in the world we live in, it can be information overload, and people can get tons and tons of information, not all of which is appropriate to the audience or relevant to the message that we're trying to send. And so we want to make sure that no one is putting in things like scary pictures of what can happen to people's teeth when they use meth for a long time, or, you know, like things that have been proven in prevention to not be effective. So scare tactics especially is one of the big no-nos. And, you know, for many of you who've been in the field for a long time, you know this stuff. And for many of you who are brand new to prevention, you don't know this stuff yet. And so that's where it's kind of a challenge to provide enough consistency and content that you can be providing consistent messages across the state while still allowing for enough flexibility to respond to your local needs. And so I think that's the balance that we're trying to hit as we, kind of walk a fine line sometimes. So as we kind of go through this, I'm not going to read through the whole 9 pages. I'll just show you that there are lots and lots of levels of information, trainings that you can participate in to learn more about a variety of topics. If you don't have access yet to Relias, it is an online training venue for people in behavioral health. You should, I believe, have access to it. As if your agency is part of IPN, which all of you, I believe all of you are. I think that the subcontractors still have access to that, as far as I know. So you should be able to go and check into all of the different trainings that are being offered either by IDPH or through Relias and get a lot more education if you're new to the field. It does talk here about dosage and frequency. And so they have set kind of a minimum of 10 trainings in each service area for each year, for year 1 of the grant, sorry, because we're getting started late. And then a minimum of 12 for any subsequent years. So for SOR, we only have 1 subsequent year right now, but we've had that situation several times now. So we'll, assume that it's possible that we'll continue to get funding. And they want to make sure that you're providing trainings to a minimum of 3 separate organizations. So you can't just say like, we're going to provide trainings to, each division of this one company or this 3 branches of this library or whatever. It has to be at least 3 separate organizations. And that's, assuming small counties, right? So if you have larger counties, your numbers should be bigger than that. And then the frequency is, how often, and the fact that you have to provide things in each quarter. You can't just say we're going to do all the trainings in the 2nd quarter and then be done for the year or whatever. All right, so training expectations. Leslie goes over a lot of this stuff in the prevention trainings that Christy mentioned earlier. And so if you haven't been able to participate in those or watch the recordings yet, make sure that you do, just because we want to make sure that we are providing a positive, professional, informative training that is appropriate to the audience. And that follows, of course, all the limitations that SAMHSA and the state have for things that are funded by grant funds, which are your tax dollars at work. So there's a lot more rules than you might imagine. But all in, of course, the best effort to try and responsibly spend those funds for the purpose for which they were dedicated. So there's more optional training resources, and then it goes into the media campaigns. And we started with just the See the Person, Not the Addiction media campaign. There are others. And so each media campaign gives an overview and then the core components of the campaign and what media options are currently available. As we're able to get more created, we will put them on that Your Life Iowa Prevention Media Center if they're small enough file size to put there. The things with the asterisks are too big to post on Your Life Iowa, and so you need to contact Colleen Bush at IDPH to get access to those. At this time, logos are not supposed to be placed on billboards. Just because of the busyness and the flash of time in which people are seeing a billboard. So I'm trying to be consistent with that. I hear the arguments for and against, and so we're just going to stick with that for now.
What about bus ads? They're different than billboards. Can our logos be placed on the bus ads? Like on the site, it's a...
I would say if it's not expressly forbidden here, then it's okay.
Okay.
If you already did put out the billboards, is that an
Yeah.
issue?
No,
Okay.
because I told people that they could move forward with what was in their plans, and so we've seen that. That's okay. All right. So, but in any future ones that you're, getting created, you can't put your logos on. So there's dosage and frequency of media that is actually really important. And that's one of the things that when you're purchasing, especially if you're purchasing media, if you're getting it donated, then I think you could, argue this point a little bit more. But if you're purchasing media with grant funds, you need to make sure that the dosage and frequency are relevant to make an actual impact and make it worthwhile to use those funds. And so this is the information or the guidelines that we've been given for media usage for grant funds. So you need to look at the population of adults in the county that's going to be reached and make sure that they're able to reach at least 50% of those adults in that county. And that at least 3 separate media platforms are being used for the media. Because one of the things that makes media effective is seeing the same message across multiple platforms. And so just like, when you heard your mom and your teacher and your coach all say the same thing, then you believed it more. It's the same kind of ideas that people are going to be more convinced when they see things in a multitude of places. So then there's key steps and optional training resources and implementation materials. So those should be or similar to those guidelines given for each of the media campaigns. So then we also have available the Prescription Drugs Are Still Drugs campaign that was used in the SPIF RX grant that only, I think, maybe 5 counties have still. Well, maybe it's 10. But no, that's how it was developed. So I think only 5 counties have that. And so if you don't currently have that, but you want to use this media campaign, it is designed for youth, which is why it's more attractive for some people if they have a lot of the adult focused media and want to have some for youth. So there's all that same information about this media campaign, and then there's the Meth Never Ever media campaign that you're also allowed to use, same kinds of information, okay? Because each media campaign is specific to a target audience and has a specific message for that audience. So that's why, the dosage and frequency would be relevant to that particular media campaign. For example, in this one, they're talking about the age range of 22 to 30-year-olds because that's who this media campaign was targeted to. So those are some of the details that you'll need to pay attention to with media, and put those details into your work plan as much as you can with what you already know and what you can, information you can get from the media companies that you contract with. And then the telenaloxone program, as you can see, that is not yet fleshed out. So we do want you to promote the naloxone in local pharmacies and the telenaloxone program that are available. And, we're working on guidance for that. But until that happens, please feel free to use what is available on the Board of Pharmacy website and other things that we'll be posting on the SOR website. So this document will be posted on the website probably sometime on Monday. I don't know if Kayla is available to post it today, but we'll see. And so that is, I think, Sarah, anything else on our agenda? All right, what are all your questions?
Will you give us the website?
Yeah, it's in the chat box already.
Oh, okay, thank you.
All right, I'm gonna stop sharing. And then there's Oh, Sarah put it in the chat box again there at the bottom.
Yeah.
So yeah, basically the take home message of today is, you know, SOR2 is its own grant. We do have some flexibility that's somewhat different than IPN and SIPTO, but we're trying to be as consistent as possible with the guidance given. So please allow us a little grace as we try and maneuver those lines. I have been at the provider level in prevention, and I know many of the frustrations. So I know that, please know that we're trying to do the best that we can given the limitations and the time available. That is all we have for you. So 4 whole minutes early.
Monica, I have a question.
Yeah.
And I don't know, I'm going to apologize up front. I don't know if you said this when the whole issue was going down at my kids' school. Apparently there was a bomb threat and they evacuated everybody and didn't tell any parents. So we just got the robocall. So I was getting mad messages from my mom. And so is there going to be a list specifically of the trainings that are required for just the SOR grant? Because I'm getting inundated with all these trainings and I don't know which ones are specifically required for SOR.
So here's the challenge that we've had with that. We have people who've been in the field for 1,000 years and know all the stuff. And then we have people who've been in the field for like a minute and don't know all the stuff. And then of course, everyone in between. And so we want you to, as a professional and as a coworker, recommend to your people you supervise or people you work with the ones that you feel are most relevant to your areas of lack of knowledge and or areas that you need more information. So I know that that's not a good answer, but at this time, I don't have a list of required trainings unless it's in this document and I just didn't see it yet. So read this document when it's available and then you'll know.
Thank you. I will. I like lists. I like to read things versus I don't always comprehend. And like I said, I'm truly distracted today and I apologize.
No, that's no problem. It's understandable.
And Monica, what we did for the SOR2 prevention specialists is just set it up similar to what an IPN prevention specialist would go through in terms of training and updates. And I think just adding the piece with the SIPTO coordinators, because we have an SOR2 prevention specialist. I don't call Cassidy a training coordinator, so I don't know if the language is just a little different, and that might be causing some people some frustration or some confusion. So I think it's just trying to get it all ironed out and do that. So and I appreciate the time, because a lot of times, you know, we get documents back and they have to be back within just a couple days. So I really appreciate you giving us some grace and allowing some time to really refine our work plan and then resubmitting it.
Well, I have been on the receiving end of 2-day requests for information as well. And so if it's not required, I would rather not make it due in 2 days, because especially with 19 or however many of you that there are agencies, I'm not going to review 19 all on the same day anyhow. So I assume that some people will get it in, you know, a little early. There's usually at least a few that do, and then I can, you know, get those done, and we can, you know, kind of as a team do the things we need to do before they're all on top of us. So,
Yeah, I'm sorry if I missed this, but the document you were just showing us, the guidance document, when is that coming out, or when will that be completed?
I'm trying to get it online. I don't have the access from my home office to be able to upload it to the website like I used to. So we're trying to get that up today, but probably on Monday.
Are we supposed to be using the training tracking guide given to us by Leslie, or the one we had originally gotten quite a while back, or?
You can use either one. The one from Leslie is SIPTO specific, and she has you using the evaluations and putting those into Qualtrics or having people fill them out in Qualtrics. We're not going to require that for SOR quite yet. That'll probably be in year 2 of SOR, just because, for a variety of reasons. So we do still expect you to do evaluations of your trainings, and we'll review them when we do the site visits. But the form is basically the same, except for that column that talks about the Qualtrics surveys. So yeah, I've provided an older version of it, and there's some minimal changes. We'll put the updated one on the website when we have the corrected version, but whichever one you end up with for the first year site visit is, we're not going to get real upset about. Good questions. Anybody else? All right, now we're a minute over, so, and hopefully you don't have a 3 o'clock meeting, but I do. So we gotta go. And I appreciate all your time. Thank you.
Thanks, Monica. Thanks, Sarah.